Hi, I'm Dr. Alvarez with Endobariatric.com, and welcome to our channel. And if you are new to our channel, we talk about weight loss surgery, results, tips, tricks, frequently asked questions, and some testimonials as well. And today I have a very special guest, and very special. She's got quite a story. And I want to introduce you to Marissa. Can you tell us where you're from?
Yeah, sure. Well, thanks for having me here, and nice to meet everyone. Hope you guys get something out of today. I am Marissa. I'm from New York, and we moved a couple years ago to Park City, Utah, which was a huge change.
I can imagine.
Yeah.
Yes.
It was great. It's a pretty active community, so being overweight was pretty tough in that community.
Oh yeah, especially in the Salt Lake City area. That area, everybody's very fit, very active. A lot of
Hiking,
sports,
skiing, exactly.
cycling and everything. Yes, and well, you're a former patient of mine. You had surgery how long ago?
I had surgery, so today is what, January 24th. I had surgery a little over a year ago. So it was December, I want to say December 15 of 2020.
So a little bit over a year out from surgery. What's interesting in Marissa's case is she started her journey with us looking into the sleeve as a low BMI patient. I mean low BMI, being a BMI about 30, which is a very big question on patients who are in that weight, that range, and the lower BMI, just saying, hi, I'm barely a candidate for weight loss surgery, and they question themselves as like, will I lose too much weight? Will I look sick? What will I disintegrate? What's going to happen to me, you know? And look at you. You look fantastic.
Thank you.
Glowing.
I am loving the weight I'm at now. Loving. I'm not losing anymore, but I don't need to. And I typically stay within like a 2 to 3 pound range. I kind of allow myself to stay within. So it's been really easy. The weight got down there sort of naturally. And, I was able to sort of control it.
How's your recovery with the sleeve? Well, we did a different technique on you. We did a mini sleeve, all right, which is, if you are not aware of this, it's a more mini-invasive surgery. It's same technique inside, same sleeve inside that we've been crafting for years, with pretty much non-visible incisions outside, 3 millimeter incisions. Pretty much, you probably have nothing. Yes.
Nothing.
So that's what we craft, and we don't offer this technique to everybody. You have to be, number one, a female, because males have a more muscular abdominal wall, and it's not fit for our instruments that are so delicate. And you have to be a woman with a BMI between 30 and 35. That's our criteria for a mini sleeve, and you're right there, perfect for that fit. And we crafted your mini sleeve. How was your recovery?
The recovery was honestly amazing. I had read, a lot of, I think I was on the Endobariatric's Facebook page, right? And so I knew one of the greatest things you could do is come up off of that bed, and when you can, start walking.
Yes, correct.
And so I grabbed that pole and I started walking, with the fellow people I was with that day. And, I was doing like just a lap or two. I could have went back to work within 5 days.
Yes.
I was back to work, and I work for Deer Valley, which is a kind of crazy active ski resort, actually. I was back at work within 7 days.
Yes.
But I could have went back within 5. It was an amazing recovery.
Yes.
After day 3, that was a day I was really sleepy. I was sleeping the anesthesia out of me. I think we had left here on day 3. By day 4, I really was sort of back to normal. Nobody knew that I had it. I was able to. So it was really great.
Which is what we recommend, like for a desk job, for that technique, 3 to 5 days, perfect. If you could take 7, why not? Even better. And let's talk a little bit about your history. I know you've tried a lot of things to lose weight.
I think like probably everyone sitting here has tried everything to lose weight. And as a low BMI, sometimes I feel like people look at people with low BMI, like we say 30 BMI, and we think that that's not like a weight, our society, right, like breaks up, like, obese, morbidly obese with people who are significantly overweight. I was really, it wasn't just overweight, I was really unhealthy, I couldn't get it off, so we were still, just because I was 30, I was, BMI, I was still battling with food my entire life. I don't remember a time I ever wasn't battling, and honestly, I never won the battle, not once. This procedure was the first time I can actually say I ever won the battle. There was a marked difference. I started to tell you before, and I'm happy to talk about it more, but there was a head freedom that I think we all crave.
Yes.
That came with this. So, look, what made me a 30, right? I could have easily been a 50 BMI.
Correct, because that mental freedom happens to BMIs of 30 or BMIs of 60.
But
it's here.
Right.
It's the same pathology, same thing.
100%.
Yes.
And Dr. A, I was doing crazy things to keep myself a 30. Like, I really should have been a 50. I was taking diet pills. You name it, I was on it. There's not one, I'm being very honest with everyone, I hope that's listening. Contrave, I could go on to all these different diet pills that have come out, Fen that was taken off the market in the 90s.
Yeah.
There's not a pill out there that I hadn't done. That's what got me to a 30. So when I say my whole life was a horrific battle, there's no difference. I feel for someone, I'm the same person. I'm still binge eating at night heavily with someone that was a 52. We have the same, it's a terrible addiction. There's a drug addiction out there, an alcoholism addiction, right? Alcohol addiction. Food is just a horrible addiction, and I really was addicted to sugar, food, and the worst part is, and I think we all know this, it's around me. It's not like drugs or alcohol, I can just pass by it. You have to negotiate with food all the time. This was the greatest thing, and I've done procedures. I can tell you about that too. This was the final procedure in my life that really got me not only to this weight, but there's a marked difference, like I said, in my head. That's the thing, there was never a difference in my head with anything else I've ever done. Not Weight Watchers, not Atkins, not, Jenny Craig, none of it. Yeah. None of those pills.
And I really loved how you mentioned the word before the interview, before we started. This is a great tool, because when you get that it's a tool, you've won. You have literally, how it's working for you, how it's an ally with you. And you put a little percentage, the sleeve will do the rest, and together it's very powerful. Now you're maintaining a good weight. And you mentioned that you're just fluctuating up, down 5 pounds.
I think I'm probably 5'2" right now and 117. Maybe I range from like 115 to 118, something like that.
You're right there. Perfect.
And I don't even have to get on the scale every day. I know with what I'm eating in the day that I'm not gaining a lot at night. I'm not gaining, and it's just so easy. This is also, I want to say, not only was it the most effective, but this sleeve was the easiest out of all of the things I've done as well. It was really easy to follow after. It was really easy to, this whole year has been a breeze.
Now that you mention, this has been the easiest of what you've done. Let's talk a little bit about your history, because boy, have you tried to lose weight in the past, and you've done other weight loss procedures in the past until you got to the sleeve. So why don't you tell us about that a little bit? Okay.
It's kind of comical because everyone always said you don't need the sleeve.
Correct.
Okay, 10 years ago, I thought about getting the sleeve, and I could have been, I fluctuated in weight. But 10 years ago, people would tell me all the time when I would start talking about the sleeve, you can't have it, you're not large enough. So it didn't matter that I was binging or struggling just like anyone else, and in hell, honestly. My whole life has been in hell. It's been food first, everyone else second. That's the best way I could put it. the addiction is really, it's a terrible thing.
Yes.
And I went and I ended up, something came on the market a couple of years ago called the gastric balloon.
Yes.
It's when you actually insert, this is how desperate I was. It's when you insert, right, just, I know you know this, but I'm telling everyone, a balloon physically, they put you under, so you're still under anesthesia, you're
sedated, yes.
Sedated, and they put a balloon in your stomach.
It's endoscopically placed, so you get an upper endoscopy, they go inside, and then they place a balloon, and then they inflate it. They put in a lot of saline solution, between 700 to 900 cc's. Inside that balloon, the balloon weighs because that water weighs and causes a lot of nausea, indigestion, reflux, ulcers, it embeds, it causes a lot of issues. But go ahead, I'm sorry. I took
Oh, no, do I have a story? I know we don't have so much time, but so I flew down to Aruba. I did lose some weight on it. I lost about probably close to 20 pounds really quickly. I flew down to Aruba. We're on a family vacation, and I'm clearly, something is really wrong. I have this foreign body in my stomach, and something's wrong. I'm vomiting nonstop, and everyone on the page that's obviously not a doctor on one of these gastric balloon pages is telling me everything's fine. Occasionally, you know, you vomit, and so I said, oh, okay, everything is fine. As we went through the week down there, I became just more ill. I mean, I was lying on the bathroom floor, I was delirious, I was white, my kids were worried about me. My husband's like, should we go to the hospital in Aruba? And I was thinking to myself, I don't want to go and tell people, go to the Aruba hospital and have to explain what a gastric balloon is. I end up flying back to Atlanta, then to Salt Lake City. And I was rushed to the hospital. I crawled into the hospital, and I mean, they were wheeling me through I couldn't walk at that point. They were wheeling me through a wheelchair. And we went to the hospital, and it was a Park City hospital. It wasn't Salt Lake City at that point. I'll get there. They did a CAT scan at 3 in the morning and said something's really wrong. They said, you might have a perforated stomach. They gave me at that point, and I was delirious and still vomiting because they couldn't stop it there, a 50-50 chance of living. I'm dead serious. I started to have a panic attack, right? And they drove me to Salt Lake Hospital, which is like the major hospital there. And they did emergency procedure at 6 a.m. on a Sunday morning and took out the balloon, which was actually embedded, what you just said, in my stomach. That's why I was having back problems all week. I was walking hunched over. So I seriously almost died. I mean, they said I was had I just continued like that and not come in.
No, you died.
And listen to the page, I was going to die.
That's correct.
By the way, the weight.
Yes, here it comes back on, yes.
Within, the eating disorder again kicks in, right?
Because the balloon can't stay in there forever. It has to come out sooner or later. And here comes the weight back on.
Only this time I added another 5 pounds.
Okay.
So then I get smart. Okay, I say, I'm going to do this new procedure. Again, everyone's telling me, oh, you can't do the gastric sleeve. And you're going to do, there's this procedure that had just come out called the ESG, Endoscopic Sleeve Gastroplasty.
You got it correct, yes.
There was a physician that was doing it down that was, you know, in the States, in North Carolina, and I flew out to North Carolina, and that was just a nightmare from the minute I got off that table. It was, I don't want to be gross anyone out, but it was a dirty facility. It wasn't, it was just so not researched by me, and I blame, it was a terrible procedure. In theory, it's supposed to suture your stomach.
Yeah, what happens, what is planned in that procedure is they go in endoscopically again, and they place some anchors or some fasteners to fold your stomach to mimic a sleeve, an endoscopic sleeve. Truth is, those fasteners don't hold with time. Patients have very poor weight loss. And it just makes having a real procedure like the gastric sleeve, whenever you decided to have a sleeve, it makes it a little bit more complicated for the surgeon. because that stomach has been manipulated from the inside. We do see some foldings and layers there where the stomach was plicated, and it just makes the procedure a little bit more demanding. But no, actually, now that you mentioned both procedures, the intragastric balloon and the endoscopic sleeve, I have a video on YouTube, and we'll link the video in the description below, that talks about, I believe, 6 procedures. I think it's 6 procedures that you should avoid for weight loss. And I talk about exactly those 2 and another 4. But anyway, those are on the list.
I paid, I'm not ashamed, I'll tell all of you because we all struggle this, and I would never want anyone else to lose this money. I'd rather anyone donate it if they have to. I paid $10,000 and I never lost an ounce in that procedure.
Goodness.
And I'm being really honest with you when I say that the recovery was horrific. That was the worst recovery. I suffered severe illness with the balloon. But the recovery was a nightmare on I never got my footing correct with the ESG, and it never worked. So it didn't even take it all. Maybe the sutures were loose, I don't know.
Of course, you're not the first patient that we convert from a previous endoscopic sleeve gastroplasty to a real sleeve. And truth is, the patterns mimic each other. It's again, I haven't lost any weight, or I lost some weight, here it comes back on. And I'm here to the same point, or even worse. You know, I gained even so much more weight, and some patients have to come to that point to actually convince themselves, is like, I need to take the step to do something serious about this because the weight's going to kill me. And as you mentioned, you don't have to be at BMI of 50 or 60. You could be feeling the same scenario, in the same shoes, as a higher BMI patient. Definitely.
I mean, this isn't 5 to 10 pounds overweight we're talking about. I think that's a different thing. I'm no expert, but I was, 50 pounds overweight. You might as well be.
At 5'2", it's a lot of weight.
I wanted to live. I didn't want to exist. And that's what I felt I was doing. It was taking up so much of my time that I could have been giving through the years. And I started to tell you this, to something else, to other things, to my kids, to my husband, to my job, to bettering myself, to my career, to picking up a hobby or making new friends. And I was always afraid to come out of my comfort zone. Once I got this procedure done, the sleeve done, it took me professionally, personally, in every way. I can't be more sincere, to another level that I was never at before. It gave me, and I started to tell you this, and I want everyone else to know this, I lost a lot of weight and I feel great, but more than the weight, it's the freedom, that head freedom. I started to tell you that this procedure gives. I don't mentally go crazy over food anymore. I don't notice necessarily when the bread comes to the table. I'm really actually present with whoever I'm with. I'm sitting talking to you right now, and I'm not thinking about, it's about dinner, 6 o'clock here, right? Like, what's dinner?
Or maybe a good dessert to have, or something sweet, or...
It's not great,
Yeah,
whatever. If my husband asks, what restaurant are we going to? Whatever you want. Like, I'll find something there for me to eat. I know it sounds so crazy, but that is an incredible head freedom that honestly I hope everybody can taste. We talk about tasting food. I hope everyone can taste the freedom.
Sensation.
I'm going to have like tears in a second, but the last year has been the most beautiful year of my life. And I look at these kids that had it, it's never too, I feel like, do it now, it's your life. We have only one to live, and we don't know how long we have it. And if you choose a doctor that's skilled, that only does this, I've done my homework. That was something that was really important too. I did narrow it down to a lot of, top doctors. It wasn't just, we spend so much money on our cars and our house, like fixing those up. And we need to really, I wanted to invest it in myself.
In your
There's
health.
just no better, right.
For a better outcome. good results.
Exactly.
Yes.
And so I chose the best doctor, and then I trusted, the heck out of that doctor, that surgeon, and that was you and your team. And it's been the greatest. It paid off in ways I know. I don't, like, what it's given me is not worth, I can't put a dollar amount, I mean that honestly, on what this has done for my life.
And as you mentioned that we were off cameras, it really pays for itself just with the amount of food and money you're saving.
You guys, I don't eat kids' meals because I was just saying that that's kind of, sometimes that's garbagey and that's not going to sustain me. Yes. I don't feel like a grown up at 44 years old having that. But I'll eat an appetizer for dinner. A lot of times I go to dinner and I'm not terribly hungry. Doesn't mean I don't eat, but I'll have like a tuna tartare as an appetizer for a main, right? And that would be like great for me. My husband will order a dessert. I'll literally have one bite. I mean, when was the last time I've ever had a bite of a dessert?
Just a bite and stopped.
And stopped and actually not continue to look at it and pontificate over it and all that, like, and just obsess over it. So it's been a beautiful thing. I'm understanding now what other people, what everyone else that is at a normal BMI out there is walking around feeling that I was never able to feel. And I've said this, it's like, drugs or alcohol, or it's a pretty serious addiction. And I just don't have it anymore. It's not to say I don't have to watch it my whole life and just make choices, but the choices are easy. Like, if choices were so easy before, I would have made them. We all know that, the right thing. It's just much, much easier, orders of magnitude.
Correct.
And I really thank you for that.
No, well, thank you for the trust, times two. And
I brought my daughter down here, and she's getting it done.
And now that you're here for your daughter's surgery, which times two, I really thank you for the trust in your case, but bringing your daughter down, it means the world to me, and I appreciate the trust, and it paid off today, and she's got everything ahead of her. And as you were just mentioning, and I mean, some people that are teenagers or in their early 20s or 30s, or it doesn't matter, and they're thinking about it, and maybe I should give this another try, or this another try, or this new thing came out, or now this other thing. Now I'll try this other thing, and they fail and they fail, trying to, avoid a weight loss surgery. You get to a point and you decide to take, it doesn't matter. You take the step, you have weight loss surgery. As the saying goes, best time to plant a tree was 20 years ago. You missed it, you didn't plant it. The second best time to plant a tree is today. There's always time, as you mentioned. You had it at 40-some. You wished you had done it sooner. You didn't. It doesn't matter. You took the step. You're enjoying life today. So I really thank you, Marissa, for being so honest, so transparent with our viewers. I know they're going to be getting a lot from you, because as I mentioned when we started the interview, the lower BMI patients continuously ask themselves, I don't want to lose that much. I don't want to look sick. I don't know what's going to happen with a lower BMI patient. Look at you, just amazing. And I'm really happy for you, and I thank you again for the feedback.
Thank you so much. Just for my life, honestly, for everything, for my health, for me not snoring anymore, for me not breathing heavily when I'm walking upstairs, for me to be present with my kids and present with my husband and better at my job, and I've made a lot of friends. I just moved to Park City. It's been so easy for me to come out of my shell, so thank you. Oh, and thanks for the cost savings. Honestly, that's sitting in my pocket now as a result of me not eating us out of house and home every day and binging anymore. And I also just want to tell anyone out there, if anyone wants to speak with me or has any questions at all, I'm really happy. There's no better professional and surgeon and team out there. I really feel strongly about that, and I did my research. No one has done research like I have, so I'm happy to share anything with anyone.
I appreciate it. Thank you very much.
Sure.
Thank you.
Thanks for having me.
Thank you all.